obese, it's approximately 43% of adult men versus
43%. Is that in the United States or worldwide?
That's in the U.S.
Right.
43%.
43 are obese.
Yeah, and this is according to the NIH statistics versus 41.9 of women. So there's a little bit more obesity in men, but it's not just obesity. We have to define whether it's central obesity or visceral obesity, the harmful one.
Central or visceral?
Visceral, meaning in
so
in your
define the
belly.
difference between
Belly,
central and visceral.
Pear shape, what some women call the Dad Bod, with what you used to have not long ago, that pendulous gut that looks like a walking pear with two sticks.
Hey, I've heard that the Dad Bod is actually what's hot right now.
Oh, it is, huh?
Yes.
Yeah, I'd like to interview those millennials and ask them about that. I bet they're all about to throw up and nauseating. The Dad Bod is sexy, right? Uh-huh. Yeah, in your dreams, dude. And so women get excess weight in the subcutaneous tissue in areas outside of the visceral compartment. Why is this important? Because the visceral compartment, that fat storage there.
Visceral meaning?
Where your guts are, in your belly.
Okay.
Right? As opposed to on your flanks, on your sides, on breasts.
Yeah.
Right? On the hips.
Right.
Right. What is the difference between that type of obesity, the visceral one, the one in the belly, versus the other?
Yeah, what is the difference? And
that
why?
You produce all kinds of hormones that cause more insulin resistance, more impairment of your metabolism.
The location of?
Yes.
What do you think is the mechanism? Why does the location matter? Why is breast tissue good for your hormones, but belly fat, sexy dad bod belly fat is not good?
Because there are hormones that are produced in that belly fat that are not produced in the other subcutaneous areas where fat gets stored in women that increase inflammation. So those hormones are called adipokines and pro-inflammatory hormones.
Did you say adipokines?
No, adipo.
Oh, adipokines. Okay.
Adipokines.
You said it so quickly that I didn't.
There's a table game called
like adipose tissue.
Yes, adipose tissue, and then
I'm trying to
the
break it down with the
cytokines.
Greek. Yeah,
very good. Yeah, see. So we should make a Monopoly game out of this. Like here, like you go on the board, you trade these adipokines for the non-toxic lipokines, right? So until you're at the boardwalk, and then you go, you're done, right? So those produce inflammatory hormones that increase blood pressure, increase cholesterol, increase insulin resistance, so result in diabetes, prediabetes, diabetes. Okay, so they cause all the bad things.
So
directly.
So men, when they get fat, tend to get it there.
Correct.
And women, when they get fat,
in subcutaneous
sometimes
tissues.
get it there, and that's when it's dangerous.
Correct.
But when it's in the other good places.
Yeah, it's not as harmful.
Right.
Right. Because the classification of obesity is done with body mass index, it just takes the whole corporeal weight and their height.
So men and women, not always, but typically have the same weight. The man's going to be in worse shape.
Correct. In worse shape. Correct. So that will beget more of the diabetes complications, like hypertension, the cholesterol abnormalities, because you get what is called dysregulation of fatty acid metabolism, or in simple terms, your cholesterol is bad.